So the health department had promised that the casualty ward at the Charlotte Maxeke Academic Hospital in Johannesburg would be operational by the end of April. That was last month. But there are indications that it may not quite be ready yet for the reopening. You'll recall the hospital was gutted by fire, or at least sections of the building were gutted by fire, and it's taken quite a long time to fix. And at this stage, it's only expected to be fully repaired next year, 2023. Let's talk about the situation then at Charlotte Maxeke. We can speak now to Professor Adam Mohamed, Head of Internal Medicine at Charlotte Maxeke. Prof, a very good afternoon to you. Grateful for your time. As someone who's based at Charlotte Maxeke, has there been progress? Do you believe that the government will be able to reopen the casualty ward by tomorrow, perhaps?
So, good afternoon, and thank you for inviting me to give an update, which I think is quite critical for the public to actually be aware of. So the casualty, there are still some challenges and teething problems that need to be addressed, but Solidarity has actually addressed the major issues. We have received permission for occupation and utilization from the city of Johannesburg in specific reference to the fire regulations and meeting all of those requirements. Those fire doors, those fire walls, and all of that are in place. However, it's going to be a phased re-entry that needs to be understood. Right now, with immediate effect, and which has already started yesterday, part of the casualty has been to open up an acute psychiatric unit or ward where we can decongest and assist with the burden that's been placed at Helen Joseph for the last year and a half. And this is already, patients are being transferred out of other facilities and are being taken to Charlotte Maxeke Hospital. So that's a very positive sign for healthcare users, although it's a very small number. From the actual casualty point of view, they are going to have a staggered opening in relation to different departments. With their pediatric casualty and the obstetrics and gynae casualty probably going to come online first. And the reason for not opening up the entire lot of casualty immediately, which means the trauma and the medical casualty with immediate effect, is because there are still some challenges regarding the CT scan, which is not yet up and running and operational. And you must remember the trauma unit, which is a P1 center, meaning that group of patients that are most critically ill and multiple organs involved, you have to have a functional CT scanner working. And we don't have that as of today. And the other CT scanners in the hospital are still not functionally 100% because they're condemned and they need to be replaced. So we're still waiting for those tenders and that CT scan to be addressed. But there is really some positive improvement or progress that are being made. It's the first time in a long time that I've said that in a public forum, that it looks like there is some light at the end of the tunnel.
The staggered reopening, sir, has it started? Or when exactly do we expect it to begin? And when
I think by next week we should be having the pediatric and the gynae casualty aspect being opened up early next week.
Okay.
I think towards the end of next week we should have a review about the trauma, depending on the scanner being addressed.
Is there a date in mind as to when the full reopening of the casualty unit can be expected?
You know, I'm the last person to give a date out there because we've had a date in December, January, February, March, April, and it's so not fair on the other hospitals to put out dates there and to inform people and then we let them down. I think, I have both my fingers crossed and I paid quite a lot, but I think we would be criminal if we don't do anything possible but to have the casualty complex up and running before the end of May, and that includes all the aspects of the casualty and not just one or two aspects. We still need to maintain pressure on those that are there to get this done.
And let's speak about the pressure on other facilities as a result of the fire that damaged sections of Charlotte Maxeke. You mentioned the Helen Joseph Hospital. That's where we've been reading reports that the situation is so bad that people are waiting sometimes for hours just to get basic care in the casualty unit there. How much of a difference would the reopening of the one at Charlotte make?
I think from a trauma point of view, both Baragwanath and Helen Joseph are taking a significant burden. And I think the opening of the full casualty complex at CMJ8 is going to make a dent into these other hospitals' burden. But remember, we're now going into winter, plus we have the uptick of COVID, and we have I think a challenging flu season coming along. Every single healthcare system is going to feel strained, and we need another 1 or 2 regional and district hospitals to be established and be built in Gauteng, in southern Gauteng, not just Gauteng, in southern Gauteng, if you want to make a difference. We need more hospitals, not just fix what we have, because we are already underburdened, no matter how many are we using.
And to what extent has the relationship between health officials or management improved? Because I recall a time when there'd been a letter written by professionals at Charlotte Maxeke, seniors in fact, who had complained that there'd been, and I'm paraphrasing here, communications blackout, and not much was being said about work being done, when it would be finished, and how that would affect the various workers from doctors to nurses at the facility. Has it improved?
I think there is some improvement from the management or the doctors that are in the management to engage with the staff of CMJH. But let's not sugarcoat stuff. We still have major parking issues that have not been started to be worked on. It's going to happen in May, but from the time that the Department of Health took over to now, we're still waiting for actual workers on the ground. The block that is damaged by the fire still needs to be assessed. The forensic report for what caused the fire and the structural damage to the building, it's still not yet open to the public, and we still haven't had any access to that. So there's not 100% transparency, honesty, and truthfulness coming from all those that be. So although we're moving forward, and I think a lot of the time we must acknowledge the healthcare workers that are actually doing job descriptions currently not theirs, like pushing furniture, cleaning the wards, cleaning the cupboards, that the nurses and the allied staff are doing things beyond their job description to get what needs to be done. And I think the government can do a lot more and should be doing a lot more. And I want to still acknowledge Solidarity that is doing a lot. And with the stores that are going to be fixed up in the hospital, which is around 50 million rand, that task has been undertaken and been given to Gift of the Givers. And that's what is happening, not Department of Health. That is going to be undertaken by the public via the Gift of the Givers.
Professor Adam Mohamed, good to have your time, sir. Thank you very much.